Rosalia's memorial garden at her parents' home is a quiet place of reflection for her mother. Almost 6 months on from the 5-year-old's death at the Canberra hospital, she's still angry about the way she feels she and her family were treated as they waited for hours in the emergency department watching their little girl fade.
I felt like I was an inconvenience standing by my daughter's side.
What Katrina says she didn't know was there was a process she could have started to get a second opinion and possibly ramp up treatment. The Call and Respond Early or CARE program, promoted on posters like this one, provides a hotline to call a senior nurse if a patient, family or carers are still worried about the patient's condition after speaking with ward staff. The hospital says patients are supposed to be informed about the program on admission, but Katrina and other former patients have told ABC News the posters are seldom seen and they weren't aware the program even existed.
Obviously, if I would have seen something like that, I would have called the number.
There's an awful amount of information that needs to be provided to patients when they're first admitted, and this sometimes is probably one of the things that gets missed.
Canberra Health Services wouldn't comment directly on Rosalia's case, but say efforts are now being made to make sure posters are more prominent.
We've made that improvement and now we're undertaking a formal gap analysis of where else we can improve that program.
Calvary Hospital in Bruce also has a care system, and healthcare consumer advocates want to see improvements like promotion through multiple accessible formats like online video to promote awareness.
I think if you could find it, watch it, re-watch it at a time that you needed it, I think it would land more.
Katrina concedes she may never know if having a second opinion might have made a difference for Rosalia, but she hopes other families will have the opportunity.
I really do not want any other family to go through what I have to go through every day.
Canberra Health Services expects to implement recommendations from its review of the CARE program early next year.